taking this, we're 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 taking with a pinch of salt.
Hello, ladies and gentlemen, and welcome to another episode of A Pinch of Salt, a podcast by ERA. My name is Andrej Kobernet. I'm a nephrologist from Slovenia, and today we have a very special episode for you. We'll be talking about narrative-based medicine. Now, I'm going to assume that most of you have not heard of this term yet. I myself got acquainted with it only a couple of years ago, but lately I've become convinced that this is one of the most valuable tools in communicating with patients and understanding them, and them understanding you as well. And since there's a lot of that in nephrology, we've decided to include this in our podcast. Essentially, it's all about using the core principles of storytelling in practicing medicine. And here to talk about this is Dr. Amy Waterman. Amy is working in the Houston Methodist Hospital and has a long-standing interest in trying to use stories to benefit patients and physicians in their understanding of each other, and particularly in the transplant population. She'll be trying to explain what narrative-based medicine is and how it can be useful. Amy, welcome to A Pinch of Salt.
Well, I'm so happy to be here. Thank you so much for this amazing European audience.
All right, we're very happy to have you. So we're going to start off a bit by learning something about you and how you approach this field. Can you tell us something about yourself, where you're from, and how you got into this line of work?
Absolutely. So I am the director of patient engagement at a major transplant center in the US. And I'm a very unusual type of person to be working there because I started with a degree in English. And then I moved into a PhD in psychology with a focus on building care pathways to help patients. So where I come from as a clinician now is to really say, okay, patients begin where they begin. And our job is to invite people to learn, to partner with us, and to move patients from where they started, which is in a wide variety of places, as we know, to moving forward into positive health outcomes. So in the case of transplant, it could be that a patient completes their waitlist evaluation. It could be that they get a transplant and they recover very well. But obviously, depending on whatever the clinician is working on, their different outcomes. So what came up way early in my career, which I think is common if you're talking to patients all the time, is that they begin anywhere from, we're fully partnering with you, 100% doctor, you just tell me what to do and I'll do it, which is what we all hope would be where we can start. And that's wonderful. And from a readiness standpoint, from the theories of helping patients be ready for action, that's a group where we're very well positioned to make a difference. But what we also find that there's patients who are scared, who are resistant, who are thinking about doing something healthy, but maybe not be fully there. So when we come in and we say, maybe you need to lose some weight to be eligible for transplant, we're met with sort of dead silence, right? Or polite ignoring. So the piece that I think that we started to look at is, how do we create other tools that could help all of us and honor that the patients are beginning in different places. I don't think that it helps to blame anybody. It's just to say we need to start with where they are, and we need to be as effective as we can in inviting learning and action. So narratives came to me actually in terms of a tool, because I got, in the case of living donation in the United States, there's 6,000 people, maybe 7,000 that donate a kidney every year. So those are amazingly interesting people. They have a lot to contribute. But the other part, since there's only 6,000 of them and there's 300 million Americans, you may never meet them, right? So if some family is facing a decision, would they ever donate a kidney, or would the patient receive a living donor kidney, the chance of them meeting someone in their church is, maybe, right? You know what I mean? Like in their general community. So my kind of practical brain was like, well, could we capture the wisdom of these potential donors and these patients who've experienced living donor transplants and put together libraries, like national libraries of stories? And then could we have the ability for a curious learner, a scared learner, someone who's not yet shown up at a transplant center, they could privately go and learn. The other part, from a sense of making a difference and increasing the number of donors in the case of the United States, is maybe their media campaigns, or you think about what could happen if we had these wonderful stories that are really influential for education, for media, for what could this tool be used for the public in general. So the way that I think about stories right now in my practice is there's value of narrative medicine directly for people dealing with a health challenge and their families and caregivers, potential donors. But there's also a value of narrative medicine for increasing awareness of the general public for the kind of things we're trying to improve and prevent in terms of, health challenges, period. So it's really an exciting and wide open area that includes every potential learner, not just the people already ready to go.
Yeah. That sounds really interesting and relevant to me as well. I've come to this from a slightly different angle. I just was very lucky to get the chance to speak about using stories in clinical practice at the ERA meeting last year. And because I've been doing this for a long time without even knowing that people are working on this. And so I've used patient stories with other patients and even non-patient stories. And I've always found them to be more convincing than talking scientifically to patients, because the only people that really understand scientific talk are scientists, and that's like 0. Whatever 1% of the population. And even beyond that, stories through history have been designed for us to understand them and to care about them. Actually, that's what we do when we hear stories. And we always communicate more or less with stories. Even if you go with your friend for a coffee, it's going to be, listen to what happened to me yesterday, and then there's a story. Or I've got real problems with my elderly father, and then there's a story. We actually always communicate by stories. So how have you seen, from your perspective, stories actually making a difference in the work that you've been doing, and the work
Yeah,
that
that's
you're
so great.
acquainted with?
I I think stories, I was thinking as you were talking that stories are safe and familiar, right? Like if I said to you, can I tell you a story as a physician? I don't think you're going to get a lot of resistance, right? Like I'm going to get can I tell you a story of another patient? Or let me tell you my experience as a physician. I'm finding that by sitting with people, as a psychologist, I think that sometimes we start from the wrong place, and we start from a place of, I know based on your numbers and where you are, what I would recommend would help you. Okay. It's a great place with a good heart, and it's very smart. But where the patient is sitting is in a place of what's important to the patient. Okay. So they are sitting there and we're here. Let me tell you what you should think is important. And then they're over there and really what's important to them. So the feeling to me on stories is I sit with people, and the first question I often ask as an educator and a patient engagement person is kind of, what brings you to the transplant center today? What's important to you today? And I'm actually listening in that place for what they care about, number one, and also what kind of information, whether it's stories or education, could actually contribute to where they are in the moment. And I have found that what they say about stories, there's 3 areas in which stories are really effective. One is that they're authentic, which is what I think we've been talking about, right? To hear if they don't know me or trust me, I don't have a long-standing relationship, but they get to hear a story that the person very quickly says, I'm one of you, I'm dealing with what you've dealt with. That's authentic. The other part is funny. Funny stories connect with people, which I think I was like, in healthcare, could funny stories matter? But I also get, sometimes people come in and they're really scared to be with me. And so funny, people acknowledging that these are the challenges. The other part I think with our work is seeing people who are at the beginning in our practices and hearing stories of being at the other side of a journey that they're about to begin has been really great, because I think the patients, sometimes they don't want to move because the moment where they are in learning and facing a surgery and having to do a big behavioral change like a weight loss effort for a year seems daunting. So when you hear on the other side a story where somebody who looks like you and wears clothes that you wear, speaks your language, says, all right, it was hard for me. And let me tell you why I did it. And let me tell you what I got out of it and what I would want to tell somebody who's facing this journey at the beginning. And I think that someone who says that is tons more effective than anything I can say as a clinician. And I also think that that plus me is doubly effective, right? So
Yeah.
if we can
Hmm.
find what's important to the patient, have a story that honors and hopefully reduces challenges and also invites them into some kind of positive health growth. And then I'm able to provide the level of clinical knowledge and the guidance and the answering questions that come up. I always say it's stories and a clinician encounter are very effective often. I also think stories are really good to send in the electronic medical records prior to a visit. I actually think they may be some of the most important things to reduce anxiety and to get people kind of in the mindset to start to talk to you. We can, I always say we send parking information. Here's where you park. And, when you come to your first appointment. But then also if we say, let me give you some stories of people who've had successful transplants, all they have to do is watch those. But I think that stories like that, if you're hearing authentic gratitude, joy, honesty about the work that it's going to take, they could walk in the door with a great mindset.
Yeah. Yeah, yeah, I have the exact same experience, especially the power of stories to convince and convey information. I mean, if you think about it, I mean, Hollywood makes billions out of that, right? So there has to be something about it. And yeah, it's just everything from the simple initial act of clinical history taking, where I really like the idea that I've read in some storytelling books, is that you don't approach the patient by going, I'm going to be the one who tells you what's going on with you. It's you approach a patient by thinking you're going to be the one who tells me what's going on with you.
Mhm.
So you're going to tell me your story, not me. And in trying to convince people, because it's often clear what the problem is, but convincing or just addressing how this issue can be changed. For example, for a very short story for people who I think really need to stop smoking, I usually don't, start reciting the risk factors for, getting lung cancer, the percentages or stuff like that. I usually tell them, well, we all know that person who's 90 and still smokes, right? That guy on his porch drinking coffee and still smoking and feeling fine. And of course, there are people who can smoke up till 90 without any problems. The problem that you have and me with you is that you're not that person. So that story is not yours. So you're going to be the one who has a lot of problems from smoking. And usually that they all laugh when they hear that. It's not funny, but they all laugh because they just realize the reality of the situation. So yeah, really, really
Well, what I
powerful
also
stuff.
think, if I can talk about that
Yeah,
exact
sure.
story, it's like you went from being an authority, right? You're a doctor, you have kind of bad clinical news to impart, and you're going to
Mm,
challenge them to have to change. But then by kind of telling a story, you also became real, right? You're
mm,
a fellow human being. Do you know what I
yeah.
mean? And
Mm,
I
yeah, oh,
work with
yeah.
a lot of patients. I find someone said recently to me, they go, you have a lot of humility as a clinician. And I was like, I take that as a pretty big compliment, because how am I supposed to be here saying, I know what's better than you? And I always say, for me, I know a whole lot about kidney disease and transplantation, but you're the expert in your own life. So let's put these two together and see how we can, we can do what's important to you. And that frame does not create resistance. And the literature in psychology where they talk about how to move people forward, they say you actually have to assess where people are, assess their readiness. They're open and motivated. They're still deciding. They're closed and mistrustful. You assess that kind of just informally as you're having conversations. And then based on where they are, there are different actions you can take. The people who are earlier in their readiness would really benefit from narrative medicine. So it's like, rather than jumping to say, okay, you're going to need to lose 35 pounds in the next year, that's going to not land well. in their
Yeah.
world, right?
Mm.
So the key is let's talk about options. Well, what's important to you first? And then let's listen to some stories of other people who are facing the same situation and see which ones resonate for you is a big word that I use. What resonates. And what's interesting is I don't know what resonates. So I just show different stories of people who, are talking about, yes, the doctor told me I had to lose weight. And then I went and I had to find a gym. And then, oh my gosh, I found this solution or GLP-1s or whatever they talk about. And at the end, the patient will say, I really liked that guy's story, or that when the woman said this, I agree with that. And it breaks open a way to have them connect somewhere that isn't where they are today, but also to go of these different options of stories about where I might go next. That one I kind of trust more, like more, and then that leaves us as a clinician to be able to go, okay, great, tell me more about that. What about that? Would you be willing to try this? We have a program. It's called Positive Health, Positive Kidney Health, and I worked on this with a lot of leaders at UCLA before I went to Houston. And what was really interesting about it is we said there's a few ways you can manage your kidney damage going forward. And the goal of the intervention was to have them choose which way they wanted to start with, right? So it was like you can stop taking NSAIDs, or you can start exercising more, you can stop smoking. And so what we did was we actually had a bunch of responses of how we would act after they chose where they wanted to go. It was a bit of a choose your own adventure type of, but it's a choose your own positive kidney health action where you say, oh, okay, I could do all these things. Here's some stories about what people have chosen to do. I can follow that path. And then we say, okay, great, let's build that. And then let's provide pharmacy support and clinician support. And let's see if we can reduce that risk factor, basically, to kind of speak our language.
Yeah, that sounds great. Yeah. And I also like the thing that you mentioned starting off this explanation is that how it doesn't really take away from your authority if you are relatable. I find this also, for example, with dialysis patients, sometimes you have years of you know them for years or even decades, and they still see you as an authority figure. And sometimes when you say, guys, I'm actually just a normal human being. They start laughing
Yeah,
because
they
they
do.
recognize that, yeah, you probably are. But that doesn't really take away anything from the authority. I mean, if they're in medical trouble, they'll still ask me for advice.
Yes.
They're not going to be like, you're a normal human being, I'm not asking you for advice. So
I
it
actually
doesn't.
think they'll start to
Yeah.
tell us the truth.
Oh yeah.
My
Yeah.
theory is when you're talking to an authority, your motivation is to look good and to get a grade of an A and to get them to go away.
Yeah. Yeah. Yeah.
But I think
Exactly.
if we're human beings advocating for them, then they'll be like, can I tell you something I feel really vulnerable and embarrassed to talk about? And I'm ashamed that I even have to bring this up, but I skipped medication, right? How many times have I skipped it? And I'm like, okay, great, let's talk about that. Like it does just, I don't know, it's a hard world. That's what I've been saying. Just in general, the world seems to get more complex, more expensive, more challenging, and I really get that this kind of approach of including humanity and stories is actually a way to kind of center on what I think why we were all in medicine to some extent.
Yeah, definitely. And I mean, I found that this is so important because so much is dependent upon how well you're able to talk to your patient. We're really trying to bring these elements into our medical school because they haven't been traditionally there. Nobody talked with us about that when I was studying. So I think that, and I find that the students are very responsive to the humanistic aspects of medicine. Are you also involved in medical education? Do you also
I
have that
am.
experience?
I appreciate you asking. So let me tell you a
Mm.
fascinating project that relates to stories. So I was on the medical education kind of working group at UCLA. And we were talking about the stress of when new doctors that are in training make a mistake. And
Yeah,
the idea is you go forward, you have your best interest of the patient at heart, and you do the wrong thing, or you cause them injury, or worst case, you have a near miss or a medical error, right? If you think about all the wide number of things that can happen. And we talked a lot about it, and I've done some work on how do you support physicians after errors, not
Mm,
just patients. And we talk about how there's multiple victims of errors. When an error happens, yes, the patient is affected, but also their family. But the piece that often gets discounted is that everybody in healthcare who got up to do something positive is now scared, upset, angry, depressed, and then they have to keep pretending that it's fine. And so what we realized in the research was that uh, physicians felt the most comforted to talk to another more senior physician who
yeah.
had and to share the stories of, yes, I had a similar situation or even a different situation that was devastating. And in this moment, rather than to go to the review board to talk about why it happened where you're criticized, you go to a fellow compassionate physician or peer who says, we get you. Do you have the support you need? The research also shows that people that are involved with medical errors that aren't seeking support, they can really they can become alcoholics, they can quit the profession. In rare cases, they can commit suicide because it's so devastating that this happened on their watch. So I really get that stories of compassion peer to peer, and I really love the doctors. They were thinking about building a digital storytelling library of the senior most successful doctors talking about a moment of challenge or failure
Yeah.
and where they made their peace with that, and where they what they would tell other people as they grow as physicians and healthcare providers. And the fact that a kind of someone you want to emulate would come down off their pedestal and say, let me tell you a really bad day in my life, and I want to tell you that I'm still in medicine, you can recover, it happens, that kind of thing. So we were actually thinking in medical education of having a whole support kind of side of it that included stories. The other part, we thought when we were doing certain discussions of certain health areas, that you'd start with a story of a patient that had that disease, and then you would learn about the disease, right? So
Yeah.
it would be like, okay, today we're going to talk about kidney disease. Let
Well,
me
that's
have
very
you.
interesting. Yeah, that's very
Yeah, and
interesting.
then it would be all medical after that. But so it was fascinating to hear what was possible.
Yeah, in terms of older physicians helping you out, I remember there used to be a very legendary surgeon in my hospital who liked to advise us young, fresh doctors or students. And he said, you do realize that every single physician has a small part of the graveyard devoted to him, right?" That was
Oh,
like a really
wow.
grim mini story, but because he validated the fact that it does happen, it kind of
Yes.
made it easier. So yeah, that's
Well,
great.
what
Thank you
did
for
he say?
sharing
Can I
that.
ask you? So you heard him say that. So he
Yeah,
acknowledged that, well, some part of the graveyard, yet people are going to die on all of our watches, right? But is
yeah.
he saying a part of the graveyard that he was somehow part of an early death?
Oh yeah, he was saying that. He was
Okay.
saying guys are you're gonna send people to the graveyard somehow at some point, whether you want to or not. And it's not most medical errors are not major nuclear disasters. It's just a huge series of
Yeah.
small things happening one after the other, and you're a small part of that story, but you still feel very bad. It can really bring you down horribly.
Yeah.
It's
And for
not.
me as a psychologist, then it's like, okay, we have a lot of strong, important people in authority positions who need support. How do we provide that without judgment and safely? And so I
Mm,
think that that's as much of a like, how do we support our growing physicians, and our healthcare providers? How do we support people facing challenges as healthcare providers? And then also, how do we face all these vulnerable patients that are trying to do these hard things we tell them to do? Yeah. So it's really, I think about stories like how can you sprinkle them in as an additional tool is really a question that I ask a lot in new opportunities. And I think that people immediately can see where they would go. So I don't have to know, but I'm kind of like, what kind of stories would we collect for you is another really important question. What questions would you want a patient to respond to on a video
yeah.
or an audio like this? Knowing the content that matters is also critically important, I think, because we can talk in general about anything, right? So how can this podcast be optimally valuable is a question that you all are trying to figure out. And for me,
Exactly.
with the narrative medicine, what does a patient need to hear that makes a difference? Right. So you could hear somebody just saying, I'm so sorry were recently diagnosed with kidney disease. Okay. Does that help? Maybe. What about I had that same barrier and this is how I overcame it? Does that help? We don't have a lot of science yet about how, when we integrate this kind of content into our practice, what kind of changes it makes. So as a geeky scientist, I kind of want to really look into this in the next few years to kind of say, now we have a lot of understanding of, if you're going to ask someone to share, what would they share about? What would a doctor who's just faced a near miss want to hear from their senior authority, right? Like, knowing that helps all of us then be more effective.
I really appreciate it, and I think it's going to have a major impact in clinical medicine. That's my humble view when these
Well,
things are
what do
more
you see?
widespread.
So just so I know, so I'm over here just doing the good work and trying to make this. What do you see could be possible if this was more kind of leveraged across our practice?
I think the understanding of patients about what is happening to them will be way bigger. All of the most successful patients I know are really well aware of what's going on with them, are really mindful, involved, and they have a lot of firsthand information that can really change your view on how to move forward. Because most of the times, people, as we are, we're stubborn. We're used to our own our own practices, our own things that we do, and then we're like going through our head into the wall, and then suddenly maybe just somebody says, and hey, you don't need to go through the wall, there's a door there. It's like, oh my god, there's a door there. Why didn't you come sooner? So
Yeah.
I see a lot of that happening, and if you want to reach a person, you usually have to reach them on a human level, not in a high flying ethereal level, just on a basic human level. And that's mostly storytelling. That's how I see it.
Interesting. As you were talking, I was thinking about how lots of people have done all the things we're going to ask our patients to do, right? Lots of people before. And
Yeah.
so what I watch often is the overwhelm of, like, okay, you're going to have to now change your health practices. You're going to have to do lots of medical appointments, all of that. So I was thinking about support groups as a different type of support. So you hear it, I always say stories are one directional peer support, if you think about it, for patients. So you turn on a story and the person on the story says, let me tell you what I've went through and what I'd recommend. Great. But one direction, and you can't ask any questions, right? So another area where it's even better is support groups, where you bring someone who's new into something into a group of patients who are advocating, and then you can both have those stories be shared directly and live, and then you can also ask questions and get guidance. And the work in the psychological research area talks about when patients are better activated, which I thought was a very formal and not clear word, but the idea is the patients have agreed in themselves to partner better with healthcare. So an activated patient is someone that when they walk in the door, they're going to have a caregiver with them to take notes. They have people they have a set of questions. They've done some
Yeah.
research themselves. And what research has shown in general for many areas is, if the patient walks in activated, specifically with their family also activated, then you are going to have better health outcomes. And
Oh,
there's a
definitely.
form. Did you know about the PAM, the patient activation measure?
No, I just do know that if male rheumatology patients come with their wives to their outpatient clinics, that the success of treatment is way better, and it doesn't
Yes, so you
surprise me
see
one
it. You
bit.
see activated patients. So I
Yeah, I
think
do. I do.
experienced doctors, they know. They're like, this person's going to adhere. The piece that's interesting, though, for me is, all right, so if anyone's interested in assessing their own patients, the patient activation measure is a validated measure that people use. And you can say the level of activation that they are. And you can look at it changing over time. But the thing that is really interesting for me is that, how do you change someone? So if you see the person with loved one sitting in the seat, you know, you've got some influence there and power, right?
Yeah.
I want to know, what about the patient who's mistrustful, overwhelmed, and barely listening to what you're saying? And so I talked to my support group coaches that are patients at a national level, the leaders in patient support, and they said, look, the way you increase activation is you train people peer to peer how to do it. So it's not like the patients that sit with their caregiver, they already know, right? The people that come in lost, we have to put them in a structure such that we can give them teach them approaches to partner with us. And if we don't do that, we get a patient who is not really fully with us, fully educated, fully motivated. And so that kind of work stories can be part of, support groups can be part of. There could be programs that are about, look, these are things we recommend that you do at home, or you find a caregiver. Like with transplant, it's required. You have to have someone that is designated as your support person. And obviously they have to help you when you're healing from transplant, but you also have that person there to help you with the journey. And so all this stuff is kind of it's the secondary, there, all these things that I study are the secondary things that ultimately influence the clinical outcomes. Do you know what I mean? And if we don't have time, that often the clinical care people are focused on the main things. Not that that's wrong, but if we can put them together, we're going to be more effective.
Yeah, things like that are the glue of medicine. So you can't build a house with just bricks. You need something to keep them together, right? So
Yes.
Thank you very much. I mean, we're kind of running out of time a little bit, so we just want to go to the final question, which is also somehow about stories. It's a question where you get to know you a little bit better as a person. So we ask everybody in this podcast, which book, 2 songs, and a luxury item would you take to a desert island? Book, 2 songs, and luxury item.
Oh, interesting. Okay. I didn't read these before, but I want to tell you the book that I'm currently geeking out on is called Essentialism. And it's a book that says, in this world of complexity, how do you prioritize what's really essential versus all the other things? So I don't know that this would be the only book I take on a desert island, but at the moment I'm in a journey of saying, how do we be most effective by focusing on what's most important? And then
$1 million question. Yeah.
Yes. So it's a great book. Let me think. The 2 songs that I would think, I like ambient music. Do you know what ambient music is? It's
Well, I
basically,
think I do,
Brian
but
Eno is one of
yeah.
the famous people for it. And it's this music that gets really quiet and it doesn't even sound like music. And how he kind of invented this genre is he was in the hospital and he could hear like the sounds of the machines at night. It was very quiet. And he realized, and like it was a sound almost of quiet with a little bit of sound. And there's this whole genre that when I listen to it, the idea is it gets you really calm and then all your creativity comes out. So anyway, that's a thing. And when I'm writing papers, I'm always listening to like something from the ambient area. You can look that up in like your libraries and say, Amy likes that kind of music. And then a luxury item. What would I take on a desert island? Okay. All right. I went to an Airbnb and I was totally stressed out. I was trying to take care of my 80-year-old mother and she doesn't have room for me. So we went to this Airbnb and I was tired, and the Airbnbs have weird things in them and often not what you want them to have. And I found this blanket and it was a really soft, heavy, oversized blanket that was like you got in it and you felt like like it was the perfect amount of comfort and softness. And my cat also agrees, because every time I'm sitting in my sofa, the cat will need as well. So that is also right for my cat. And I've now gone on eBay and I have bought this blanket in like many colors. And I joke, whenever I'm stressed, where's this super amazing soft blanket? And if anyone wants one, you go on eBay or wherever, and it says the peace love blanket. And it has the perfect weight. And if I'm stressed out at the end of my clinical day, I'm going under the blanket, the cat will join me and all will be well.
Yeah. Well, that sounds like the ambient music equivalent of a blanket. At least
Yes,
the feeling sounds the same.
yes, I'm
Uh,
actually all about, so yeah, it's interesting that these would be my choices, because I didn't think about them ahead of time, but I basically try to create as calm of a space and loving of a space, and then from there go out and do the patient complexity and the good that I'm
yeah.
doing. And I've done it for a long time, and it makes me a very a better human being, I think, to have those things in place.
Sounds great. That's what I love about Japan as well. The Japan gives me that whole feeling.
Yes, I was just
Um,
there. I agree fully.
and if you like ambient music, I would highly suggest that you check out Melody Gardot, Gardot, a very special singer, very special lady, very special personal story, and a very special music that comes out of it. So
I will
similar
definitely
kind
do
of to
that.
Brian
Wow, that's
Eno's
great.
experience. Melody Gardot, heavily advised to listen,
Oh, I
check
also
her out.
my recommendation also in it, I think they're performing in Europe now, but I as a young rebellious teen wearing black was always following a group called Dead Can Dance. Have you ever heard
Oh
of that band?
yeah. Oh, that's
It's
cult
another
legendary.
soundscape.
It's
It's a
legendary.
soundscape type band. It's
Yeah.
not ambient. It's like, but my recall, it was the best concert I ever went to, because you got in the concert and you kind of could shut your eyes and they were pouring a sound experience on you. It was less about us, songs with refrains, and it was more like I was like, whoa, and
Yeah.
so that would be another recommendation for the group.
Yeah, the British equivalent to that would be, I guess, the Cocteau Twins.
Yes, I love the Cocteau Twins and have seen them in
Yeah.
concert too. Have you seen them in
And
concert?
no, unfortunately. I just heard her sing with Massive Attack, Elizabeth Fraser. And the modern version would be Cigarettes After
Cigarettes
Sex.
After Sex, I have
That
seen
would be the
twice.
modern
Okay,
version.
we have, what is this genre that we're talking about here?
I don't know. Take it easy genre. I guess it's the take it
The
easy
take it
genre.
easy genre. Yeah,
The
it's
take it
kind of
easy
like,
genre.
yeah, you come in and I think, yeah, I don't know. I'm stressed out enough being a healthcare provider so that I just sit there and I'm just like, good, calm and energizing and experiential things are happening around me, and I'm good.
Perfect, Amy. We'll leave it with that. That's the perfect ending. Thank you very much for joining us.
I'm honored to be here. Thank you so much.
Ladies and gentlemen, this was my last episode of A Pinch of Salt. On this occasion, I would like to share a couple of words, primarily to show my appreciation and gratitude. I would like to thank the ERA Council for supporting this project and allowing us to have the opportunity to try and develop this novelty. All of this would not be possible without the excellent support of the ERA office, headed by Monica Fontana, and executed brilliantly by Laura Azzolini, Manuela Lorusso, and Letizia Melle. I'm very grateful that through this project I got the chance to meet and get to know George Kosmadakis, my co-host. Collaborating with him was always interesting, stimulating, and joyful, and one couldn't wish for a better companion in this endeavor. I also have to single out Kate Stevens, Jennifer Lees, and Andreas Kronbichler, who were involved in the initial development of this podcast, and Kate and Jennifer supervised it for a number of years effortlessly and gracefully. We definitely have to thank all of our wonderful guests who really made an effort to try and provide the best possible answers to deceptively simple yet difficult questions. Last but not least, I want to thank you, our listeners. We try to provide you with information that would affect how you perform your clinical work and help you be better at diagnosing and treating patients. I firmly believe that podcasts are a great platform to discuss things that are traditionally not discussed extensively in congresses, webinars, and papers, like important clinical dilemmas that have no evidence-based answers. I hope that we were able to do that for you. Without people listening, all of this would be meaningless. At the end of the day, it is your participation that makes all of this meaningful. So thank you, my fellow colleagues, and please continue following A Pinch of Salt. There is much more to talk about.